Okay, so first of all, my name is Chris Ford. I'm the president here at Intelliware. Thank you for coming to our second community event, engagement event this year. We did an initial event this year in the spring on affordable housing, and it was very successful. Some of you I recognize from that. Thank you for coming back. Intelliware has been in business for 33 years, and we solve problems with technology. We like ideas, we like solving problems, and basic income is a really inspiring strategy for dealing with a lot of the most serious problems that we face as a country. So today, we are going to explore that topic. Many of you are, actually some of you are the country's leading experts on basic income, so thank you for being here. I'll introduce you in a moment. But many of you are just learning about the topic. And it sounds basic, but there's a lot going on. So we're gonna have a series of speakers today, and the goal is education, is to understand what it's really all about and what, as a strategy, it could do for us as a country. So again, thank you for being here, and we're gonna get started. We have a full agenda. I'm gonna introduce these lovely people as they speak and as we go. So, but we've got a full agenda. We're gonna start with Dr. Evelyn Forget, who's here from Manitoba.
Testing.
Yeah, wait a second, I'm not done. She's here from Manitoba, but that was not a far enough drive, so she drove to Ottawa first, and then she drove here last night, so thank you for doing that. Yes, why? I'm sure she has a good reason. She's a professor of economics and community health sciences at the University of Manitoba. She is an appointed fellow of the Royal Society of Canada and an officer of the Order of Canada for advancing anti-poverty initiatives in Canada and around the world. And we got a few authors here tonight. She is also an author of the book, Basic Income for Canadians, The Key to a Healthier, Happier, and More Secure Life for All, which was shortlisted for the 2018-19 Donner Prize. So we're very lucky to have her here. Thank you again for coming. And she's gonna get us started.
Well, thanks. Thanks very much, everybody. I'm enjoying the vibe in the room, so thank you all for coming out. It's really great to see so many people interested in the idea of basic income. My job, I think, is to turn into a university professor and see if I can bring the mood down a little bit, chill to sleep for half an hour or so. What I thought I'd do is to tell you a little bit about my background and why I'm interested in basic income, to define the concept of basic income, to tell you what I think it means to advocates in Canada. And then I'm going to spend a little bit of time answering some of the questions that people have asked me over the years. And if I don't get them, maybe you'll have some time to ask me some additional questions. First of all, why am I interested in basic income? I'm an economist who's employed by a medical school, right? If you're an economist who's employed by a medical school, you only ever get one question to answer, and you can probably guess what that is, and that is, how are we going to pay for this, right? How are we going to pay for healthcare in Canada? The demand for healthcare keeps increasing, and we don't have the resources to do it. More and more sick people are showing up in our emergency departments, and, how do we deal with it? And then you walk around the hallways of the hospital, and you talk to patients, and you talk to clinicians, and you realize pretty quickly that people are coming into your hospitals, and they're using your health care, not because they have some strange virus or, they're genetically impaired. A lot of them are there because they've lived really, really hard lives, right? They don't have enough money to feed and clothe themselves. They don't have decent housing. They've worked in really hard jobs for a really long time. They've injured themselves on the job. And you think, all this money we're spending on high technology in healthcare, what if we could think about different ways of making people healthier? And so I'm really interested in the concept of the relationship between income and poverty and health outcomes. And I first started working on the idea of basic income after I became an economist working in a medical school, because I remember this old project that took place in Manitoba many, many years ago called Mincome. And in the mid-1970s, there was this idea that we could introduce a basic income in Canada. At the time, it was called a guaranteed annual income. And what researchers were interested in at the time was a question you've all heard, or at least probably have floating around in your minds, and that is, if we give people money for nothing, who's going to work, right? So they were worried if people would quit their jobs. Now, it turns out I'm not really interested much in whether people quit their jobs, although I'll talk about that in a minute. But I am really interested in whether people who got a basic income are healthier. Does their health improve? And so I was able to go back and to find some data and to look at the people who received a basic income and compare them to a matched group of people. And I found that hospitalization rates fell for people who received a basic income by 8.5% relative to the control group. Now, if you're a numbers person, floating around in your mind might be the idea that this country of Canada spends something like $80 billion a year on hospitals. And if hospitalization rates can fall by 8.5% by making sure that people have enough money to eat properly and to live indoors, to have shelter from the cold, you know, are we allocating our money the way we ought to be allocating it? So that's why I'm interested in basic income. And I'm probably going to talk about poverty a fair amount in the next little while because it's poverty that brought me to this. But let me start by talking about what I think basic income is. Basic income is a regular, predictable, guaranteed transfer of money from the government to individuals sufficient to meet your basic needs. Doesn't make people wealthy, right? But it allows you to live in a reasonable way. It can take different forms, but there is a fair degree of agreement among people in Canada. I'm sorry I keep looking at my notes, but I'm getting old and I can't remember where I'm going. There's a fair degree of agreement among advocates for basic income about what it is. So the money's coming from governments to individuals. It's sufficient to meet your basic needs. It's available to you if you have no job, if you have no wage income, but it's also available to you if you're working and you don't earn enough to live above the poverty line. So the idea is that if you receive a basic income, you should have enough. You should have enough to survive, to live a dignified life. And I'm just going to hold my notes here if I can. But there are a couple of additional things I need to mention. First of all, basic income's only cash. It's only money. And money doesn't solve all the problems that we deal with in the world. So we need a lot of other social programs too. We need things like healthcare. We need supports for people with disabilities. But a cash transfer from the government can replace other cash transfers, some very inefficient cash transfers we have built into the system today. So it can replace things like Ontario Works, income replacement through Ontario Works. It can replace things like the GST refund you get on your income tax and other kinds of tax credits you get from the province or the federal government. But it doesn't replace the services that we need in order to survive. And another thing that most advocates in Canada agree with is the idea that basic income probably should be income dependent. We probably don't have to give a basic income to people who earn enough money to live a reasonable life. So it should be focused on your income. If you're not working, you have no income, you'd receive the full basic income. If you do work and you earn some money, your benefit would be reduced, but it would be reduced by less than what you earn. So it gradually tails out as your income increases. So for example, if you earn $100, your benefit might fall by $50, right? Gradually disappears. So by the time you get to middle and upper incomes, excuse me, by the time you get to middle and upper income levels, people are not receiving that money. Excuse me. So thank you. The very first question that people ask, and it's one I heard yesterday at the Senate, and that is, why do we need a basic income? Don't we already have that? It's called Ontario Works. So, how's basic income different from Ontario Works? First of all, there's the question of adequacy. There's not a single income assistance program in the country that pays anything close to the poverty rate. Excuse me, for single adults, it's about half the poverty rate. So a basic income would allow you enough money to actually survive. Second of all, it's available to people who work. There isn't a hard wall where if you earn, you have the freedom to earn something like $200 or $500, and as soon as you do that, your benefit disappears entirely. Because of the way the program's designed, you can continue to receive that money, even if you're working, until your income reaches a higher level. And thirdly, and perhaps most importantly, it's unconditional. What do I mean by unconditional? It means if you want to register for a class, you can do that, right? You can take job training, you can do whatever you want. You don't need special permission from your caseworker. It means they're not going to take the money away from you if you miss a meeting with your caseworker. It means you're not going to lose your benefits for rather arbitrary violations of rules that you may not even understand exist, and you're certainly not going to lose your money because you earn a little bit. So the money's unconditional. It's something you can count on from day to day. Second big question, okay, maybe it's not Ontario Works, but like we've got a lot of programs in this country that try to address poverty. Indeed we do. Just recently, a particular group of people counted up some of those programs. We have hundreds of programs in this country. Excuse me. Some of them are offered by the federal government. Some of them are offered by the provincial government. Some by municipal governments, some by nonprofits. They're all within this broader range of anti-poverty initiatives. Some deliver cash. Some deliver particular services. Some are complicated mixtures of the two. But we've got hundreds of different programs out there. So it's not like we don't have programs that address poverty. What we have is this incredible mess of programs out there that address poverty. Between these programs, there are gaps that people fall. Hardly anybody receives all of the benefits to which they're entitled because it's almost impossible to figure out what programs you might be entitled to receive. So it's actually a very complicated system. And one of the benefits of a basic income is to make that system a little bit simpler, to have a single gateway, to reduce the number of different cash transfer programs that you have to apply to, so that we're not asking people at the very worst times of their lives to find their way to a library and figure out how to use a desktop so that they can create an account and find out whether they actually qualify for a program that they heard about from somebody somewhere. We can do better than that. So that's the idea, at least in part, of a basic income. Here's one I particularly like, and I was asked this just a little while ago. Is a basic income necessary still? I've got data right here. We've got really hard economic times, and yet the poverty rate fell from 14.5% in 2015 to 6.4% in 2010. Clearly, we're well on our way to eliminating poverty without a basic income. Poverty rate fell from 14% to 6%. Do we need a basic income? Well, those numbers are correct, as it happens. So what happened? Well, two things are worth thinking about. 2020, when the poverty rate fell to 6%, the government had decided to introduce a whole lot of pandemic relief programs. So those numbers show us that when a decision's made in order to support people, it actually works. So in 2020, the poverty rate fell to 6%. 2021, when people started to fall off those programs, the rate rose to 7.8% or something. And as the numbers for subsequent years become available, they're going to raise higher and higher again. But it's certainly the case that the poverty rate fell between 2015 and 2020. And one of the reasons we have to thank for that is the massive expansion of the Canada Child Benefit in 2016. Canada Child Benefit is a sort of a basic income for family with kids under 18. That's what a basic income looks like. Families with kids under 18 receive a basic income. Seniors are another group of people in this society that receive a basic income. Seniors receive the OAS and the GIS. unconditional money. The one group of people who get left out of this equation are adults of working age, adults between 18 and 64. Why is that? Well, we come back to that problem that people were thinking about in the 1970s when they thought about Mincome. Turns out that this is a really, really complicated group of people. 18 to 64 years old. Why aren't people working? People should work in order to support themselves, according to a lot of people. They're a challenging group. And if we introduce a basic income, will they stop working? I want to say that the best evidence we have is that no, they don't. If they were working before a basic income came along, they continue to work after a basic income came along. If they weren't working when a basic income's introduced, sometimes they start to work because a basic income helps people stabilize their lives. It helps them spend a little bit of time trying to find a job that matches their skills, gives them the opportunity to upgrade their skills, to retrain. Maybe a basic income can actually increase work effort. Most of the empirical evidence says doesn't much matter. Basic income, no basic income, no change, no significant change in the number of hours worked. Now, I know I sound like an advocate when I say that, but I'm going to quote no less an authority than the Parliamentary Budget Officer, who actually surveyed all of the economic evidence out there on what happens if you give people a basic income or a basic income-like program. And they decided, after running a whole lot of numbers and talking to a whole lot of people, that probably if you introduced a basic income, the number of hours worked would fall by, wait for it, 1.5%. 1.5% reduction in the number of hours worked is not a large reduction in work effort. So people don't stop working. But I think we need both. The solution isn't to try to choose between whether we need good labor market policies or a basic income. We need both. People need to be paid decent salaries for the work they do. We need to have decent labor legislation that protects workers. But we also need a basic income for all the people who can't work. And there are a lot of reasons that people can't work. And we know that there are people with disabilities, who may not be able to work enough hours to support themselves. Many of those people receive supports from disability programs, but many of them don't. A lot of people apply for disability support year after year after year and never receive support, and that's particularly true for people with intermittent disabilities and mental health disabilities. It's very difficult for that group of people to access these programs many times. Sometimes there are no jobs available. Bank of Canada decides inflation's a real problem. If the Bank of Canada decides 1 million Canadians are going to lose their job in order to keep inflation under control, you can bet 1 million Canadians are going to lose their jobs. And there's not a lot that individual motivation or individual work ethic can do to change it. The government of Canada and the Bank of Canada can control the aggregate level of employment in the country. If there are no jobs available, there's nothing much that people can do. Sometimes jobs exist, but there's no transportation to the jobs that exist, particularly for people in rural areas and remote areas. There are a lot of reasons. I think one of the things that strikes me after a little bit of talking to people is that there are a lot of people who've been through such tremendous amounts of personal and generational trauma that they have to do a lot of work on themselves before they're ready to do any work for anybody else. We need supports for people. We need supports for people going forward. One of the other things that people sometimes ask is, now you're talking about marginalized groups in society. You're talking about people that have lived unhoused for long periods of time. Nobody can expect anybody who's lived on the streets for a long period of time to go through a short job training course and to suddenly become employable at a living wage. It's really hard to do that. Maybe what we need are social programs that are focused on the particular needs of these groups. And in fact, we do need those programs. We need programs for people who have issues with substances, We need programs for people who don't have job skills and need improvements in their job skills. But we can't force people into those programs. If we try to do that, it's both ineffective and it's a bit demeaning to ask people to go through these programs in order to meet their most basic needs. A basic income, I think, allows us to do a little bit better than that. So, now my two economic questions. Will a basic income lead to inflation? One of the things we've heard very recently, of course, is that, this economy is falling into a period of inflation. This is not the time. This is just not the time to introduce a basic income because it causes inflation. The answer to that's a little bit complicated, so I'm going to ask you to bear with me as I try to explain it, or try to talk about it. One of the things that might lead to inflation is if a basic income is deficit financed. If the government borrows money in order to offer a basic income, that could lead to inflation, especially in the current climate. I don't think any advocates for basic income are suggesting that. I think we all recognize that if we're spending money on a basic income, we've got to pay for it. And there are a couple of ways that we can pay for it. And I'll talk about that in a second. But I also want to talk about inflation in a slightly different way. People have been saying for a long time, and here in Toronto, you're going to be particularly sensitive to this, that if you give people a basic income, rents are going up. And in fact, every dollar that goes to people in a basic income is going to be taken by a landlord. And in a very short order, the landlords are going to be better off, but renters are not going to be better off. People who receive the basic income are not going to be better off. I think that's not true, and I'm going to offer you a little bit of evidence for why I think that's not true. And the reason people believe it's true is because if you think about Ontario Works, or you think about any income assistance program across the country, there's a shelter component of basic provincial social assistance. And there is a category of housing that you can rent for what's paid out as a shelter allowance. It's usually the least acceptable housing to anybody. It's usually very, very run down, and it's just one step above homelessness. If Ontario Works decides to raise its shelter allowance by $10, rents go up by $10, just lockstep. They go up automatically, and it disappears. And so people say, how would a basic income be different? Well, I want to offer you a little bit of a story about what's happened in Manitoba. In 2015, we introduced a program in Manitoba called Rent Assist. And Rent Assist is a portable housing benefit. It's designed very much like a basic income. That is, if you have no income, you get the full amount. As your income increases, it declines gradually and disappears. No one knows who's getting support. You get it if you're on welfare, that is, if you're receiving provincial income assistance, but you also get it if you're working, if your earnings are too low to raise you above the poverty line. No landlord knows who's receiving rent assist, and no one knows how much anybody's getting, right? There's no way to identify it. It's also portable, so it's not going to the residential hotels on Main Street in Winnipeg that, rent rooms for $650, shared bathroom, shared kitchen deal. It's going wherever people want to spend it. And when I tell that story, a lot of people say, well, that sounds like a basic income. It's not a basic income, and the reason it's not a basic income is you need rent receipts in order to get it. So if you own your house, you don't get it. If you live with family, in order to save money, you don't get it. You've actually got to be paying rent. So it's not really a basic income, but it has some features of a basic income. And what happened? Canada Mortgage and Housing Program, CMHC, did a study of rent assist in Manitoba and concluded that it did not raise rents in Winnipeg. Didn't have an effect. So I don't think basic income leads to inflation. And I think those fears are overblown. The last thing I think I want to talk about is a question I alluded to a second ago, and that is, how are we going to pay for this? What's it going to cost? Sheila Reguer just showed me a story in the Star this morning that said that basic income was going to cost $85 billion a year. I've heard worse, right? We got 40 million people in Canada. If you give every one of the 40 million people $20,000 a year, that comes out to, sorry, arithmetic's not my strong point, 8 quadrillion or something, $8 quadrillion. That's not really how you calculate the cost of a basic income. If somebody receives a basic income, their income goes up, they pay taxes on it, they become ineligible for some other programs. There's a lot of interrelationship between these different programs. And if you do that, the 85 billion goes down really quickly to $40 billion, according to the parliamentary budget officer, which is still a tremendous amount of money. But here, this is what's important. That $40 million doesn't consider the fact that if you're receiving a basic income, you don't need provincial social assistance anymore. Provinces collectively pay over $20 billion a year in social assistance right off the bat, so half of it can be paid for almost immediately. There are other programs that can be made consistent with the basic income, that can be coordinated with the basic income to help pay for a basic income. And if you do those kinds of things, you can get the cost of a basic income right down to zero. And you can do it in ways that don't hurt the poorest people in society. You can do it in ways where the burden is felt very largely by people in the highest income quintile. That is, the highest paid 20% of people in the population. So you can pay for it. But I'd like to say something else about the cost of a basic income. We always focus on the upfront costs of getting money into people's hands. But remember the story that I started with at the very beginning of this. The idea is to get money into people's hands so they can buy themselves better diets and better housing, better clothing, and so on. And if you do that, there are all kinds of improvements you can expect to see in society. You can expect to see less demand on the healthcare system. That is, healthcare costs will grow more slowly. But try to think of any social program we have in this country, any social problem we have in this country that's not made worse by poverty. Think about expenditure on education. How much do we pay in education in order to bring kids up to grade level? Kids who've fallen behind because their parents can't pay the rent and they move too often from place to place to place, and they lose that connectivity and that continuation. Think about the criminal justice system. 80% of the women who are incarcerated are there for poverty-related crimes. So think about all of the costs for all of these social programs. So the returns are something we never ever take into account when we talk about the costs of basic income. We focus on those upfront costs, and we never ask how society will be better, how people will be better off if they get access to a basic income. And thank you for bearing with me. I'm going to end with just one thing. Something I've heard over and over and over again recently is, these are really hard economic times. Inflation is soaring, interest rates are really high, government has a huge deficit. How can we talk about this now? Yes, you've convinced me basic income would be a wonderful thing, but not now. We'll think about it in the future. And I want to end by saying that, times are always tough. There's not a time in history when the economy is not in crisis or falling into crisis or just climbing out of crisis. When Mincome ran in the mid-1970s, it had all of these tremendously good effects. It turned out that people didn't quit their jobs. It turned out that people were healthier. When they got to the end of the project, as planned, the researchers wanted to continue the project. They actually wanted to implement a guaranteed income. It didn't happen. They were told instead to archive the data because times were really tough. At the end of the 1970s, inflation rate was I know, 13%. Interest rates were, well, they were rising to 18 and 20% for people on their mortgages. So times were really tough. In 1984, the Macdonald Commission on the Canadian Economy reported, and they recommended a number of things. One of them was NAFTA. Another one was a guaranteed income. We got NAFTA, but times were really tough, and so we decided not to have a guaranteed income. I think that we've got a tremendous opportunity right now in the wake of the pandemic, and I think we've reached a point where we can recognize that the system we currently have is broken. The system has let a lot of people down, and we're seeing the consequences right across society. Our frontline workers are burning themselves out, trying to meet the needs of people who come to them for assistance. It's not effective. We can do better than that. And so I think this is a time when we ought to be thinking about a basic income and about how we can implement it. Thank you.